Hello, my name is Kennedy, and I'm excited to share with you my journey and experiences that have influenced my professional identity in nursing. Here is a brief overview of what I'm going to talk about today. First, I will share a little bit about my journey to nursing school. Then I will touch on the history of nursing as well as my development of professional identity. And finally, I will discuss NICU nursing briefly as well as some future goals that I have for myself as a nurse. So, why do I want to become a nurse? My inspiration for nursing began in 2019 when I got diagnosed with a brain amoeba caused by encephalitis. I got very ill pretty quickly and ended up being in the hospital for quite some time. And due to my condition, I had to be supervised 24/7 by a bedside nurse. But I'm very grateful for that experience because it made me realize that I truly wanted to be a nurse. My nurses helped me with all of my activities of daily living, eating, drinking, sitting up, walking down the hallway, you name it, they were always there for me. And to this day, I still remember some of the names of my nurses. So I really hope to one day have as big of an impact on my future patients. And on the right, you can see that's a picture of me sitting up on my first day after getting a lumbar puncture. So that was a pretty big day for me. A recent experience that I had before starting nursing school, I was able to shadow General Surgeon Dr. Paul Kolkman in a few mastectomies and lumpectomies that he performed. He really helped me develop my professional identity because I got to see firsthand how he always prioritizes the needs of his patients, whether it be in the operating room or in his clinic when he's doing his consultation visits. I was amazed at how much he respects and treats his nurses as teammates, and I hope to one day work for a surgeon as amazing as he is. He really loves the opportunity to have students shadow him and learn from his vast experiences, so maybe one day I will work in the operating room. Another experience that I feel formed really the foundation of my professional identity in nursing was my role as a medical assistant. I was able to be the MA for two different providers, a nurse practitioner and a physician assistant. And with this being my first job in healthcare, I was able to see the importance of empathy and communication in my interactions with their patients, as well as clinical competence as I worked to address patient needs. This role really helped me develop ethical awareness as I documented patient interactions. I returned phone calls and voicemails that patients had with concerns, administered medications and vaccines, ultimately responded to any questions or concerns that the patients may have had to help my provider. So I truly think that this job kind of formed the foundation for my professional identity in nursing. Now I'd like to talk a little bit about the history of nursing and how it has influenced my journey. One of the hallmark milestones in the history of nursing is the creation of the world's first nursing school at St. Thomas in 1860 by Florence Nightingale. And this is referenced in the article Florence Nightingale, the Mother of Nursing. I chose this milestone because I truly believe without the first nursing school, we wouldn't have all of the incredible nursing schools that we have today. So she really laid the foundation for nurses to pursue education. And here is a picture of her on this slide. She emphasized sanitation and used statistical analysis in the Crimean War to show people that hygiene and good sanitation practices reduce the illness and disease rates in populations. So I really think that we have her to thank for the development of the field of nursing. Some of the values in nursing that I experienced during my encephalitis journey in 2019 were advocacy, compassion, and self-determination. Regarding advocacy, I saw firsthand how incredible my nurses were in obtaining pain medications or any non-pharmacological interventions that they could think of, really anything to help relieve the severe headaches that I had following my lumbar puncture. And my nurses were compassionate in that they quickly learned how much I love animals, especially dogs. Once they learned that, they requested some of the hospital's therapy dogs come up to my room and visit with me. They were also incredible advocates of patient self-determination in that they never pressured or coerced me into doing any treatments that I did not feel up to doing. This aspect is also reflected in the ANA Code of Ethics, Provision 1.4. Now I'd like to talk a little bit more specifically about my professional identity in nursing. These are some of the characteristics that I hope to embody one day. I hope to be caring as nurses have the opportunity to be there for patients during their most vulnerable moments. I will be collaborative when working with other nurses as well as providers so that I can absorb as much information as possible and be the best nurse that I can be. I will also be resilient in that I understand being a nurse is challenging with good days and bad days, but I will always remember my why. And lastly, I will be accountable as I know that I will make mistakes and nobody is perfect. That doesn't necessarily make me a bad nurse. I will just use those mistakes to become a better nurse in the future. I love Gene Watson's theory of human caring. I really think that it summarizes the reason why most people enter the nursing field because we really put others' needs before our own. One of the articles that I found summarized Miss Jean's theory with the goal of nursing is to protect, enhance, and preserve human dignity. And I feel that nurses have taken care of me throughout my life really take that to heart. By practicing human caring, nurses embody the core of their professional identity in nursing, compassion and respect for human dignity. Now I'm excited to discuss NICU nursing as my chosen field of interest. Some of the considerations that I think novice nurses should have regarding the NICU field is that you're providing care to the tiniest humans and they truly require specialized care. The families of these NICU babies are relying on you and trusting you to keep their baby happy and healthy, especially when they're not there. And I understand that having a baby in the NICU is probably one of the most challenging experiences that families go through. So it truly is up to the nurses to be there for the babies when they're at their most vulnerable moments in their lives. The organization that most NICU nurses are a part of is the National Association of Neonatal Nurses, or NAN, and their mission is to enable nurses to restore health for infants and their families, as stated on their website. NAN works closely with the ANA and truly aligns their mission with the ANA Code of Ethics, just tailoring it to babies and their families. And they provide resources and education to NICU nurses. They also advocate for NICU nurses to enhance their skills and expertise in caring for babies. A couple certifications available to NICU nurses are the NRP, the Neonatal Resuscitation Program, which is a course offered by the American Academy for Pediatrics, and it's an online program with a combination of online learning modules and hands-on skills. The CCRN is Critical Care Registered Nurse, and they have a focus in neonatal intensive care, and they do require your RN or APRN license and a minimum of 2 years of direct care of critically ill neonatal patients. Finally, I'd like to share some of my goals for my future nursing journey. As I look forward to possibly becoming a NICU nurse, some of the values and professional identity that are important are caring, collaboration, and resilience. I look forward to being there for infants and their families while working with a team of nurses and providers to make sure that we provide the best patient care possible. And I do have a couple goals for myself. My first one, a big one, is to pass my NCLEX in January 2027, shortly after nursing school graduation. And then I also hope to earn my CCRN certification within the next 5 years. A few challenges I anticipate along the way. Time management, of course, nursing school is tough, so learning to withstand the challenges and the workload will be, I'll just take it one day at a time. Really, that's the best way to address that. Money, obviously, it's challenging finding work when you're busy in nursing school, but saving as much as possible. I think it will all work out. And then also, I'm a little homesick. My family recently all moved out of Texas, so I'll just make sure to visit home whenever possible and FaceTime when I'm unable to travel. That is the conclusion of my presentation on my professional identity in nursing. Thank you for your time, and I also have some resources here that I used throughout my presentation. Thank you. Have a good day.